why do individuals experience trauma differently? It's an age-old question, and one of the easiest things to think about in asking this very complex question is, what else is going on in that situation that might protect you for that individual? Is it someone else that is there that is able to offer them support, that they were there so they understand what they might go through? Are there other factors that are in place, meaning did the individual carry a history of trauma or a previous event of that sort that makes that second experience or third experience worse? The other part is, how much support do you have afterwards? Do you have someone to talk to? Is it believed? That's another part. How serious does someone else process that trauma with you? So those are all cumulative factors that changes the way someone will react towards what are ultimately negative events. But it comes down to what are your risk factors, I'm calling them, before, and what happens after that event. There is no genetic weakness that comes with this, which is something that I think is really important to understand. There is no timeline and when you are expected to react negatively to an event. So you also need to give yourself some time to process how you might feel about something. And if it comes up 5 years later, we deal with it then. And so it's in those that I hope that we see differences in reaction, that it might not be immediate, and be patient with those individuals as they go through that process.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.